For the organization, if the two of you would please split your time, we have about 7 minutes, and I know that's not a long period of time, but you'll get a chance to respond to questions and perhaps get some additional points in play as you go. So, Dr. Fischer to start? Please, sir.
Honorable Senators, good afternoon. It's a great pleasure to be here with you this afternoon and share some of our experiences and provide input into this important legislation. Let me start with the fact that we are, of course, in favor of Bill C-45 and the legalization of non-medical cannabis use and supply. We see this as an option to really improve public health and safety related to cannabis use and avoid most of the adverse consequences related to prohibition as they have unfolded. For decades, we have explicitly supported this effort for many years, even before it became a policy initiative. The devil's in the details, though. This is a Canadian approach and actually will be a major social and policy experiment. And it will depend on a lot of details and determinants whether things go well or not. And this is really the issue that I want to speak here today. Concretely, I want to speak quickly to 5 key points in the legislation or related to the legislation that I think still warrant some consideration. The first one is the provision of home growing. In my opinion, it's categorically misguided as part of the supply scheme for cannabis in a public health and strictly regulated approach. It's a recipe for people producing cannabis that is unregulated to expose minors and other vulnerable people who shouldn't be exposed to cannabis, and a recipe for diversion. It doesn't belong in a public health oriented supply framework for cannabis. The provision should be scrapped. Secondly, focus on advertising and marketing. I'm concerned with the fact that this is still handled in a fairly sort of loose way. We know very well from experience with alcohol and tobacco that advertising and marketing, especially how it works in the electronic age, directly or indirectly, greatly influences use and harms, especially with vulnerable populations, i.e. young people, for example. The regulations here need to be absolutely tight and waterproof to prevent the kinds of harms and problems we see with alcohol and tobacco, and you have one chance to do that, which is at the beginning. Cannabis use and possession of minors. Clear recommendation here, while age limits will be 18-19, use levels among people of lower ages, minors, are among the highest in the country, in the Canadian population. This will continue despite political promises that cannabis use will be eliminated among young people. This will not happen. However, we should keep these young people punishment-free and free of exposure to the criminal justice system to avoid stigmatization, criminalization in this highly vulnerable group. There should be no criminal justice involvement, even if cannabis is used or possessed among young people. Finally, a couple of points on the need for a national research agenda. A lot of details about cannabis use and health are changing. We have new products, we have new modes of use. There are a lot of details that we don't understand well. We need a national research program on cannabis use and health outcomes, as well as on the policy options and the effects of different regulatory regimes as they're unfolding in Canada. I see mainly piecemeal efforts right now from different sides, different angles. There needs to be a national and well-funded, well-resourced research program on cannabis as part and parcel of cannabis legalization. Related to that is that we need an independent monitoring and evaluation strategy of what remains a major social and even well-intended major policy experiment. Right now there's a lot of small bits of evaluation and monitoring being planned by different players, different agencies. I'm worried about the fact of whether this will ever come together as a comprehensive evaluation in about 4 or 5 years' time. whether this actually really worked well in the interest of public health and safety or not. We need this comprehensive assessment after sufficient time to determine whether this experiment was positive or negative, and we need to rely on empirical evidence. This monitoring and evaluation should be comprehensively conducted and resourced by an independent panel or committee of scientists or scholars that are fully independent of government to determine after a reasonable monitoring period whether this really worked in the interest of Canadians' health and public safety or not. I'll leave my comments at that and hand over to my colleague, Dr. Jutras-Aswad.
J'aimerais remercier également les membres du Sénat ici présents de
Yes, I'd like to thank the members of the committee for welcoming us here, and I'm going to present in French on some of the stakes and challenges here. I'm also an instigator in the CHISM. I'm also a psychiatrist who working with people who have addiction issues, though I deal with that every day. So much as did Dr. Fischer, I have to tell you outright that I am in favor of C-45. Legalization is not the final end state, of course, and before, well, I'm in favor of good health of my patients and good health for all Canadians. We certainly hope that collectively we can set aside some of our preconceived notions on cannabis and what public health should be, so that we can minimize the impact, negative impacts of cannabis on the health of Canadians. In order to do so, the approach should be a balanced approach. An approach which would allow us to find that fine point between and among supply and demand, use and misuse, and so that we can draw users to a legal market and benefit from the advantages that such a market would provide. We can control the quality and content of the products on the market and ensure that the legal market will not simply reproduce the market as it exists today, where there's very little consideration for the health of the user. One aspect I'd like to point out is that despite we might be spending a lot of time on this bill, we might continue debating it for 30 years, but in any case, there are some aspects which are not appropriate and will have to be adjusted. The legal aspects, of course, there's going to have to be some kind of leverage in the legislative area, and that's in your hands. It's up to you to make those legislative adjustments. However, you have to also see what the scientific evidence is, and you will have to depend somewhat on the work of scientists and researchers, perhaps in things that we haven't yet covered in the bill, and which will have to be introduced at some later time. Two themes, two spheres of interest, on research interest, where the needs are very sharp and acute. We have very little knowledge as to the health effects in the long term of cannabis. We have to learn more about that, of various products in its various forms. We use a lot of products that sort of have their origins in the 60s, 70s, and 80s, but we're going to have better data on these various types of strains of cannabis, for example, various formats of presentation, various strengths. And as I said, daily, I deal with psychiatric cases. Cannabis is one substance on which we have very little information as to what to do for therapeutic use to get people off of marijuana if they become addicted. We have no idea as to what the depth, the strength, and the ways out with people who abuse of this substance.